Phimosis surgery. When is surgery necessary? I am Dr. Petronio Melo, a urologist, and today I want to clarify a topic that raises many questions among both adults and families of children: phimosis surgery, also known as postectomy. When is surgery really necessary? How do you know if the difficulty in exposing the glands will resolve itself, or if it will cause problems in the future? And what is the postoperative period like for those who undergo the procedure? Stay until the end, because I will address all of this in a simple way so that you have clarity when deciding the best path. To begin with, we need to understand what phimosis is. It is the inability or great difficulty in retracting the foreskin, which is the skin that covers the glands. In some children, especially in the first years of life, there is what we call physiological phimosis. That is, there are still adhesions between the foreskin and the glands, but they usually detach over time without the need for any intervention. This is a natural developmental process, and most boys acquire the ability to fully expose the glands by the end of childhood. In these cases, forcing retraction and insisting on pulling the skin can cause microinjuries and scars that, later on, will make it even more difficult to move the foreskin. The problem arises when, after this period of development, the foreskin remains so tight that it hinders hygiene and sexual life. This is the case of many adolescents and adults who come to my office complaining of recurring infections, or even pain and difficulty during sexual intercourse. The truth is that phimosis prevents the glands from being properly cleaned, favoring the accumulation of secretions, which creates an ideal environment for the proliferation of fungi and bacteria. When these infections are repeated several times, they can lead to even larger scars, progressively closing the foreskin. Another point that deserves to be highlighted is paraphimosis. This term refers to the situation in which the foreskin, after being retracted, cannot return to its normal position, causing swelling and intense pain. If this happens and is not treated quickly, it can compromise blood circulation to the penis and lead to serious complications. These urgent cases reinforce the importance of evaluating whether phimosis is something that will really cause problems over time. So, when we talk about the need to have surgery, we are looking at two major scenarios. In the first, the person has frequent infections or clear difficulties in their sex life, either due to pain or fissures in the skin that bleed and do not heal properly. In the second, there is a considerable risk of complications such as paraphimosis or even a narrowing so severe that it impairs urinary flow. Any of these situations is a sign that surgery may indeed be the best solution. There are also those who opt for surgery to make hygiene easier and reduce the chance of inflammation even if they do not have serious symptoms. Ultimately, the decision needs to be individualized based on a frank conversation with the urologist, who will evaluate each case closely. Now, how does the surgery itself work? The procedure takes around 30 to 40 minutes, depending on the technique and the surgeon's experience, and is usually performed with local anesthesia plus sedation or general anesthesia, depending on the age and preference of the doctor and the patient. The idea is to remove the excess foreskin, leaving the glands exposed, or to perform a plastic surgery so that the skin is preserved, but with enough opening to easily retract. Regardless of the technique, the ultimate goal is for the patient to achieve adequate hygiene, avoiding inflammation and pain during sexual intercourse. After surgery, there is a healing period of 2 to 4 weeks. In the first few days, the area will be sensitive, there may be swelling and some discomfort, but the use of painkillers and anti-inflammatory medications usually controls these symptoms well. It is also essential to follow the recommended hygiene, using water and mild soap, and changing the dressing according to the instructions. I recommend that my patients avoid intense physical exercise, especially those that involve contact or risk of impacts in the area, for at least 2 or 3 weeks. Regarding sexual life, it is advisable to wait about a month until the healing is firmer, avoiding bleeding or pain when moving the penis. Many people question whether surgery affects sensitivity. It is common, especially in the first few months, to have a different sensation in the glands, which is now fully exposed. However, most men report that, over time, the body adapts and sensitivity becomes normal without affecting the ability to experience pleasure during sexual intercourse. In fact, there are those who even notice an improvement, as they no longer feel the pain when the foreskin forced the glands during an erection. It is always important to remember that a circumcision is a safe procedure with a low complication rate when performed by an experienced surgeon. Like all surgeries, there are risks of bleeding, infection, or abnormal scarring, but these problems are relatively rare and can usually be avoided with postoperative care. Some patients are also concerned about the final appearance. The aesthetic result varies according to the technique used, but in general, it is satisfactory and does not impede sexual function. Talking openly with your doctor about expectations and possible scars helps to reassure you and ensures a result that meets your needs. If you feel that phimosis is affecting your life, whether due to pain, infections, or constant fear of complications, see a urologist. Sometimes, the issue can be resolved with less invasive measures, but if surgery is necessary, know that a postectomy usually provides definitive relief and improves quality of life. Here in my office in Sao Paulo, I see men of all ages, and I also offer online consultations for those who are far away or have difficulty attending in person. I evaluate each case individually, explaining all the pros and cons so that the decision is calm and well-founded. I hope this video has helped you understand why phimosis surgery is necessary in some situations and how it can benefit your intimate health. If you have any questions, leave a comment, share this content with anyone who might benefit from it, and don't hesitate to schedule an appointment to discuss this in more detail. Thank you for watching until the end. Take good care of yourself, and until next time. God bless you.